தாயின் காலடியில் சொர்க்கம் உள்ளது. தாயே நமது முன்னறி தெய்வம். தாய்க்கு வழி தந்து பூமிக்கு வந்தோம். தாய்மையின் வலிமையை உணர்ந்திட மறந்தோம். அன்னை என்னும் நிலையை அடர்ந்திட மண்ணை தின்று கூட வேண்டும் பெண்களின் மனக்கவலையை போக்க பிஜிஎஸ் என்னும் முறையை பயன்படுத்தி டாக்டர் அருணா அசோக் சிகிச்சை அளிக்கிறார்.
Hello, I'm Dr.Aruna Ashok, consultant Nova IVI Fertility, Chennai. So, I'm going to today tell about pre-genetic screening as advanced IVF technique for making patients with genetic diseases and patients with repeated IVF failures having a good chance of becoming pregnant with a healthy baby.
பிஜிஎஸ் முறை யார் யாருக்கெல்லாம் பயன்படுது அப்படின்றத பத்தி டாக்டர் அருணா விளக்க போறாங்க.
So, what is pre-genetic screening? Pre-genetic screening is a method where the embryo is being biopsied before they are kept inside the womb of the mother. So, to whom it is useful? This is useful for patients who have advanced maternal age. Nowadays, females wanted to get pregnant very late in their life because of career, because of late marriage. So, at advanced maternal age, there are risks of having chromosomal problems. So, for those patients, it is very useful to have a pre-genetic screening before getting conceived with IVF. And for patients with recurrent implantation failures, if they have already done IVF 3 times and all the 3 times with the good embryos they have not become pregnant, then pre-genetic screening helps them in IVF to become pregnant. The other patients are repeated miscarriages, either conceived naturally or conceived with some method of treatment. If they are having repeated miscarriages at 2nd month or 3rd month, then pre-genetic screening allows them to have a better quality of embryos to be transferred. And the other indication is having male factor infertility. Nowadays, with the use of electronic communications, with use of laptops and cell phones, and with the heat being generated in the environment, male have a severe sperm factor deficiency. So, patients with severe male factor infertility can get PGS done, which will help them to have a good healthy embryo to be transferred. So, these group of patients are offered PGS.
பிஜிஎஸ் முறை மூலம் பயனடைஞ்ச ஒரு தம்பதியினர் பத்தி டாக்டர் அருணா விளக்குறாங்க.
And we have a small short case to be presented to you also. We had a patient who had 28 years, just 28 years, who had married for 4 years, came to our center. She had a history of 2 naturally conceived pregnancies. After 2 natural conceptions, first time it was 3 months, she had a bleeding and got aborted. She met a doctor and the doctor told her, you can try next time because it's only the first abortion. The next time she started trying again. After 2 years she conceived and again she went up to 10 to 11 weeks and miscarried again. And this time she was really worried, went for multiple consultations, did analysis for immunological problems, did analysis for infections, did analysis for diabetes, thyroid, and all the scans, anomalies of the uterus, everything was done. And finally, karyotyping was done for mother and for the female and the male partner. The karyotyping showed she was a carrier of Robertsonian translocation. So the patient was a carrier of a Robertsonian translocation. She went to genetic screening and genetic counseling with few centers, and they advised her to get pregnant again and try for a chorionic villus sampling at 12 weeks of gestation or 10 to 12 weeks of gestation, where a tissue is taken from the future baby and tested for a genetic analysis and find out whether this baby is a carrier of Robertsonian translocation or not. But the patient was really afraid to go for another transfer and asked for other options. And she also googled and saw for other options and finally found out pre-genetic screening. So pre-genetic screening, she came to Nova and met us a year back and she asked about pre-genetic screening, which we are doing already. So we offered her pre-genetic screening. We did IVF and explained to her that for pre-genetic screening, we need to get the embryos formed outside. So we have to do IVF for her. So we did IVF for her and got almost 10 embryos, and out of that 3 embryos were normal. So we transferred 2 embryos for her at the first instant, and she is now pregnant with twin pregnancy, with continuing well in the 5th month. She did all the blood test and genetic test this time, and the babies are both fine. So she's very happy about it. So this is example that we wanted to quote to you. We have many scenarios like that. So patients with advanced maternal age, patients with repeated implantation failures with IVF, or patients with repeated miscarriages or abortions with male factor sperm problems, we can offer PGS to them.
PGS முறையை பத்தி டாக்டர் அருணா கிட்ட கேட்டு தெரிஞ்சுக்கலாம்.
So what is PGS? even before the embryos are being transferred into the womb, the embryos are being biopsied.
பிஜிஎஸ் முறை எப்படி செயல்படுது, அதோடைய நவீனங்களை பற்றி டாக்டர் அருணா சொல்கிறாங்க, வாங்க கேட்கலாம்.
We will show you the clipping of how the embryos are being biopsied. In this, we can see the embryo getting biopsied. So this is done, and once the embryos are biopsied, so we can see, take some tissues and send it for a genetic analysis to, we are sending to Apex Center, which is situated in Delhi. We get the biopsy result within 24 hours if it is a day 3 biopsy. So we can do biopsy from a day 3 embryos or a day 5 embryos. In day 3 embryos, we get embryos, only 1 or 2 cells can be taken from a day 3 embryos because only 8 or 9 cells are there in the embryo. From that one cell, we get a report within 24 hours and transfer the embryos in the same cycle on the day 5. For patients whom we want to go for a longer culture, we do the biopsy on the day 5, which is called blastocyst stage biopsy. So we can show you the clipping of the blastocyst stage biopsy also. And then, so after the blastocyst biopsy is being done, we take the biopsy. Where in blastocyst biopsy we take 4 to 5 cells for a biopsy, and we send it to Delhi for an analysis. And from the analysis report, we transfer only the next cycle the transfer, because the embryos report get after 24 hours, and the embryos has to be frozen on the day 5. So we can do either day 3 or a day 5 biopsy. So there is a difference in day 3 and day 5 biopsy. In day 3, if we want to transfer in the same month, we can do day 3 biopsy. If we can afford to freeze the embryos and transfer in the next cycle, then we do a day 5 biopsy. But be it a fresh transfer or frozen embryo transfer, we have comparable results, even better results with the frozen embryo transfer. So no need to get worried about the frozen embryo transfer. The next important thing which I want to tell you is how PGS is being done. At the genetic lab, previously, years before, we were doing it by fish analysis, where out of the 23 pairs of chromosomes, we can analyze only 2 or 3 pairs of chromosomes. Only trisomies 18, 13, 21 were able to be done. But now, we have CGH array technique by which all the 24 pairs of chromosomes are being screened, and any addition or deletion can be diagnosed with CGH array, and it is quicker, faster. And the latest technique that we are using is NGS technology, which is called next generation sequencing, which is there from 2015 in India, where we take the biopsy and send it in the same manner, but the analysis is done by next generation sequencing. It is faster, it is cost effective, and even a small segments of chromosome, if it is either duplicated or addition or a deletion is there, we can find it of the precise, accurate information. So the sensitivity, specificity, and the rate in which we get the reports are all better with NGS technique. And the additional advantage which the patients and the clinician we have is mitoscore. It's called a mitochondrial DNA scoring of the embryo. Also we get, suppose for a scenario which I told you before, if you are going to get 3 embryos, then the clinician has a confusion which to transfer first to the patient. In this NGS technique, we get a mitoscore which will tell us the implantation capacity of the embryos. If the 3 embryos are normal, and we have 3 embryos, 2 embryos with mitoscore A and 1 embryo with mitoscore C, then it means that mitoscore A has a better implantation potential than mitoscore C. So we transfer the mitoscore A embryos, and this is done free of cost with NGS. So PGS is a definitely important and a good technique for patients with repeated IVF failures and patients with the above said indications. And with these techniques, we can offer a good healthy child for parents who are really in need of it. And we at Nova are doing it in a better scale, and it is the India's leading fertility clinic where we are doing it. and there are more 18 centers all over India. We are from Chennai and we have good pregnancies with PGS. Thank you.
பயனுள்ள தகவல்களை தந்த டாக்டர் அருணா அசோக் மற்றும் நோவா ஃபெர்டிலிட்டி மருத்துவமனைக்கு மக்கள் குரல் சார்பாக எங்கள் நன்றிகளை தெரிவித்துக் கொள்கிறோம்.